Good morning.
Hi.
Hi, my name is Sarah Aiken. I'm going to be your nurse practitioner student performing an examination on you today. May I call you by your first name?
Yes.
Okay. And Kelly, are you comfortable?
Yes.
Okay. So first I'm going to walk you through everything. I'm just going to start by inspecting your general appearance, your mood and affect, your dress, and your nourishment, and your hygiene. And then I'm going to move on to the neurological exam. So I'm going to ask you some questions now. Can you tell me your full name?
Kelly Ann Aiken,
And what is today's date?
April 1st, 2018.
And what kind of building are we in?
A doctor's office.
All right. And what time was your appointment?
9:30 a.m.
All right. And what did you do for your last birthday?
I went to dinner with my family.
Okay. Can you tell me how apples and oranges are alike?
They're both fruits.
Okay. And can you spell the word world backwards?
DLROW.
Okay. Now I'm going to be just testing some more neurological tests. Can you take your hands and place them on your thighs and then alternate them up and down as quickly as you can? Okay, great. And then now I just want you to touch my finger to your nose. And again. And again. And then with your other hand. Okay. All right, now I want you to close your eyes and tell me if I'm lifting your fingers and toes up or down. Just say up or down.
Up. Down. Down. Up.
Okay. All right. Now I want you to stand up for me. You can open up your eyes. All right, now put your feet together as much as you can and close your eyes. I'm just assessing for any excessive swaying. I'm also assessing for any tremors within tension. Or you can open up your eyes and just stand normally. I'm just assessing for any tremors while at rest. All right. Now I'm going to have you walk a little bit. I'm going to have you walk down this row. If you can just walk normally for me to that speaker. All right, and turn around. Now can you walk with your heel and toe and with one foot in front of the other? Okay, you can stop. Now can you turn around and walk just on your heels? All right, can you turn around and walk just on your toes? All right, thank you. You can have a seat back on the bed. All right, now I'm going to be doing some sensation tests. I'm going to show you that this is sharp. This is dull.
Mm-hmm.
Can you close your eyes and tell me what you feel?
Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp.
Okay.
It's cold.
All right, now I'm going to be testing some light sensation. Just keep your eyes closed and tell me when you feel me touching.
No. 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 No.
Okay. All right, and continue to keep your eyes closed. Tell me, I'm going to touch you in several places. Tell me what you feel and where I'm touching you.
Vibration on my right wrist. Vibration on my right elbow. Vibration on my left wrist. Vibration on my left elbow. Vibration on my left knee. Vibration on my right knee. Vibration on my left ankle. Vibration on my right ankle.
Okay. All right. Can you put your hands out with your palms facing up? Keep your eyes closed. I'm going to put two objects in your hand, each hand, and feel them and tell me what you think they are.
A cotton ball. A pen.
All right. You can open up your eyes. All right, now I'm going to be testing your reflexes. So just relax for me. I'm going to use this arm first. Put your hand up. Testing your biceps, and your tricep, and your brachioradialis. And on this hand, this arm, biceps, triceps, brachioradialis. All right, can you scoot back a little for me? I'm testing your patellar reflex. Okay, and then your Achilles. Okay, and then your plantar, Babinski. Okay. All right. Now, if you could please take off your gown. I'm going to be doing a skin assessment. All right. Actually, if you could just sit up for me.
Sorry.
That's okay. All right. So first, I'm just noting the general appearance of her skin, the color, any lesions or scars, any tattoos. I'm also assessing for edema and any redness. Also noting the hair distribution on your upper, sorry, I'm going to remove this. Let's put it right here. And lower extremities. All right. I'm also now just going to test for capillary refill. You can just, on your hands and your toes, I'm just going to squeeze each finger, just noting that the capillary refill is less than 2 seconds. All right, and on her toes. Okay, now if I could have you just lay back for me, you can scoot back a little bit. All right. Now I'm just going to be listening to your arteries, so just breathe normally for me. Just going to listen with the bell of my stethoscope. Your carotid. Aortic. Renal. Iliac. And femoral. Okay. All right, now I'm going to palpate your pulses and your lymph nodes, so just relax for me. First I'm going to start on this side, just assessing your radial pulse, your brachial. I'm going to lift your arm to a 90-degree angle and inspect the epitrocular lymph nodes for any swelling. All right. Be assessing your femoral pulse. Okay. And your popliteal. And assessing the popliteal lymph nodes for any swelling. And the posterior tibial and dorsalis pedis. Okay. Same thing on the other side. Radial, brachial, epitrocular lymph nodes. Okay. Femoral. Those popliteal and the popliteal lymph nodes. Okay. Posterior tibial and the dorsalis pedis. All right. Now we're going to be moving on to the abdominal exam. So just continue to lay flat. I'm first going to start by inspecting your abdomen noting the contour and the shape of the abdomen, noting any bulges, pulsations, any scars from any surgeries. I'm also noting the skin around the umbilicus for any redness and any pulsations. I'm going to test for herniation. If you could lift your head up and cough for me. Okay, you can look back down. All right, now I'm going to just be listening to your bowel sounds with my stethoscope. Okay. All right, I'm actually going to have you sit up for me. You just sit up. I'm just going to be testing your costovertebral angle for any tenderness. Just tell me if you feel any tenderness when I feel back here. Any tenderness?
No.
Okay. All right, you can lay back down. All right, now I'm just going to be doing some tapping on your belly, just some percussion. All right, now I'm going to be percussing your bladder. All right, and now I'm going to be percussing over your liver. And now over your spleen. Take a deep breath in and out. All right. Now I'm going to be doing some palpation. So I'm just going to be doing some pressing on your belly. First, I'm going to just start by palpating your abdominal aorta. All right. And now I'm going to be doing some light palpation. Just tell me if you feel any tenderness or pain when I touch. Any tenderness or pain?
No.
Okay, now I'm going to be pressing a little harder on your belly.
Okay.
Tell me if you feel any pain or tenderness. All right. Now I'm going to be pressing over your bladder, just feeling any distension or tenderness. Okay. And now I'm just going to be palpating your liver. If you could take a deep breath in. Okay. And out. And now I'm going to be palpating over your spleen. Take a deep breath in for me. And out. Okay. All right. Now that's it for the abdominal exam. I'm going to have you put your gown back on. You can sit back up. All right. So now we're going to be moving on to the musculoskeletal exam. All right, you can keep that. There we go. All right. So first, I'm just noting. Actually, if I could have you stand up for me. I'm just noting the alignment of your extremities, the symmetry of your muscle mass, noting any swelling or edema in your joints. First, I'm going to start by just pressing on your joints and feeling any crepitus, tenderness, or warmth on each joint. Okay, and on your knees. All right, now if I could have you sit back down, I'm just going to come back around and I'm going to observe your spine. So first, I'm just inspecting her spine, just noting alignment. I'm going to be palpating in between the vertebrae, starting at the cervical. Down thoracic, just noting any step-ups or any swelling, and down her lumbar. region of her spine. And then feeling the paravertebral muscles on both sides. Okay. All right. Now we're going to be doing some range of motion exercises and strength testing. So if I could have you first, we're going to test your shoulders. If you could lift your arms up for me and over your head, and then bring them back down, and then bring them behind you. All right, bring them back down. All right, now we're going to do some abduction, so bring them out to the side and down. And then if you could cross each arm over your body, one at a time. All right. Now if you could also do some internal rotation, put each arm behind your back one at a time. Okay. Now we're going to do external rotation, so put your arms at a 90-degree angle and then put them up like goalposts. All right, and back down. Perfect. All right, now I'm going to do some strength testing. Shrug your shoulders, don't let me push down. Okay. And now if you could hold your arms out with your palms facing down. Yeah, thumbs facing down. Okay. Now don't let me push down. Okay. Now could you give me the thumbs up? And then don't let me push. Okay, great. Now we're going to be doing some elbow exercises. So just flex and extend your elbow. All right. And if you could put your arms out and then rotate your palms up and down. Okay. All right. Now I'm going to test your strength of your elbows. Try to pull your arms up and don't let me push down. Okay. And on this side. Okay. All right. Now we're going to move on to your wrist. If you could face your palms up and pull your hands up and down. All right. And then place your palms face down and then go out to the side. Some eversion and inversion. All right. Now if you could make a fist with your wrist and then don't let me push. And then don't let me push. Okay. Now if you could spread your fingers out, can you touch each finger to your thumb, one at a time? Perfect. All right. Now I'm going to squeeze your fingers. Just kind of keep them spread and just don't let me squeeze them. Okay. All right. Now if you could, I want you to grasp my two fingers and squeeze them as hard as you can. Okay. All right. Now we're going to move on to your hips. I'm going to have you actually lay back down again. Okay. Now if you could lift each leg to your knee to your chest one at a time. Okay? And the other side. All right. Now can you do that again? And then I'm going to, don't let me press on you. Okay? And again on this side. Okay. All right. Now I'm going to do some range of motion with your legs. I'm going to start with your right leg. Do some extension. And then abduction and adduction. And then lift your knee. Do some internal rotation and external rotation. All right. I'm going to come around on this side. All right. Lift your leg up. Do some extension, abduction, adduction, internal rotation, and external rotation. All right. Now I'm going to have you sit back up. Okay. And I'm going to test your range of motion in your knees. Now if you could kick each leg out with the bottom half of your leg, your calves. Okay. And now I'm going to, don't let me press on you. Don't let me press. And don't let me press. Don't let me press. Okay. Now if you could flex and point your ankles up and down. Okay. Now try to press up and try to press down. Okay. And also we're going to do some eversion, inversion with your ankles. Eversion, inversion with your ankles. Now if you could spread your toes as best you can for me and don't let me squeeze them. Okay? All right. And the last thing I'm going to have you do is actually walk again. Just stand up and just walk normally back and forth to the speaker. All right, and you can have a seat. And that concludes our examination. Thank you, Kelly.
Thank you.